Thank you very much. My name is Cheurombo. I answered to Cheurombo. So in 2013, my aunt, my mother's sister, had a condition of the heart.
Very good.
And the local physician told her that she would need to travel for a surgery. And she passed on in 2014 before she was able to travel. And it wasn't the money, it was because the logistics didn't fall into place on time. So I don't have a medical background, but I am an entrepreneur in my own right. And I started researching on how I could assist to change the narrative for anyone who needed treatment which was not offered locally and get them across to wherever they wanted to go. Is medical tourism an overkill? You'll decide. Because I think it depends on where you're sitting and where you're coming from. I get a bit emotional, so I'll try and stick to the facts and to the statistics, right? I come from Zimbabwe. In Africa, as a continent, there is a shortage of healthcare specialists. I got these statistics online. In Rwanda, for example, you've got an average ratio of doctors to patients of 0.84 for every 1,000 patients. That's Rwanda. In Kenya, you've got 1.3 doctors dealing with 1,000 patients, right? So, is medical tourism an overkill? Is someone traveling outside the country to get the treatment they need, life-saving treatment sometimes, is that really being overplayed? In terms of finances, you know, there are businesses like my business, MedTours Africa, which have been founded because we've seen that there's a gap. I've got a full-time employee complement of 5 people, so that's 5 families, 5 livelihoods being supported by medical tourism. I work with different hospitals. We've got hospitals in India, the UAE, South Africa, and in India, some of the hospital representatives are here. If we ask them what their financials are, what their statistics say about how medical tourism is contributing to their books, I think we'll all find that it's a significant number. So financially, for the hospitals here in India, I can confidently say they are getting money from the medical tourism aspect. I also have facilitator colleagues who I work with, and they'll also tell you how much money is to be made from medical tourism. Medical tourism, in my definition, doesn't only affect patients. There's the aspect of skills transfer between doctors who are skilled and who've got expertise here in India or in Europe or in the UAE. It offers that platform for physician interaction. It offers that platform for skills transfer. And as MedTours Africa or any other good facilitator, any other good doctor and hospital will let you know they're interested in that, because the long-term goal, I think the long-term vision, is to have healthcare access for all. And we can only do that if we're able to afford that healthcare at the home countries. Right now, unfortunately for Africa, unfortunately for Zimbabwe, it's mainly outbound tourists. Fortunately for India right now, you are getting tourists from our side. But I'm hopeful that that narrative will change in the future. The other people benefiting from medical tourism is the airline industry as well. I know Kenya Airways, I think, has 25% of their travelers from Africa just coming in for medical tourism. If you go onto the Ethiopian Airways website, you'll see that they also have medical tourism packages. that they're offering. So is it really an overkill where you've got livelihoods being supported, you've got patients surviving, because in the home countries, sometimes the treatment is not there, or sometimes the treatment is very cost prohibitive? I don't think it is, but that's just my opinion. Thank you.